Hi, my name is Eva. I'm a nurse practitioner student. I'm going to be completing your exam today. Can you please tell me your name and date of birth?
Valentina Vanasco, 09/11/2001.
Good. And where are you right now?
In a clinic.
Good. And what year is it?
2025.
Okay, good. I'm going to be asking you some questions. Can you please tell me what you have for breakfast this morning?
Oatmeal.
Okay. And how do you spell cat?
CAT.
Good. And I'm going to repeat 3 words. I'm going to ask you to repeat them back to me in a few minutes, okay? Cat, lion, umbrella.
Cat, lion, umbrella.
Okay, good. And can you tell me, okay, so patient appears to be learn-oriented, speech is clear and coherent, patient's well dressed appropriately for the weather, looks well-nourished. Can you repeat those words to me?
Cat, lion, umbrella.
Perfect, okay. And speech is clear and coherent. Okay, so my hands are washed and cleaned. I'm going to put on some gloves. Okay, so just inspecting your skin. Your skin seems to be clear with no masses, abrasions, or any open wounds. The color is normal. For your ethnicity, there is no cyanosis, no jaundice, no redness or edema on the skin. I'm going to be just feeling your skin, okay? So your skin is warm to touch. Looking at your fingernails, cap refill is less than 3 seconds, no clubbing noted, no cyanosis noted on the fingers. I'm going to check for your cap refill, so I'm going to pinch your skin. Your skin trigger, so I'm going to pinch your skin and notice that it recoils. The skin trigger is normal. Texture is smooth. We're doing the same exam for your feet, so if you could just take off your socks for me. And whatever I'm doing to one side, I'm doing to the other for the purpose of the exam, just to be efficient. So cap refill less than 3 seconds. Feet and legs are warm to touch. Skin texture is smooth and dry. No wounds or discoloration in the skin, and no abnormalities noted. Let me just see you. Your palms are pink and dry. Okay, I'm gonna change my gloves. I'll put your socks back on. So now I'm inspecting your head. It appears to be normal cephalic. Size and contour is normal. I'm going to palpate any masses or tenderness. Any mass tenderness? No? Okay, good. Hair texture is normal. Hair distribution is normal. No signs of hair loss. Looking at your face, it's symmetric. There's no signs of facial droop. Your eyebrows and eyelashes hair is evenly distributed and it's symmetrical. I'm going to palpate for your temporal arteries. There are 2+ equal bilateral. Any tenderness? No tenderness. Looking at the position of your eyes, are symmetric and positioned normally on your face. I'm going to be feeling for your medial and lateral canthus are intact. Lateral wall system is intact. You can just look down for me. Good. Look up for me. Okay, good. Conjunctiva are pink and moist. Sclera is white. Iris is round and 2 millimeters each. Iris is normal shape and size and color, and pupils are 2 millimeters each. Cornea and lens are clear with no opacities. Now I'm going to be doing some tests for your vision, okay? So I'm going to have you cover your right eye. Good, and we'll do tests for your peripheral vision. Just tell me when you see both hands.
I see them.
Okay.
I see them.
Good, okay. And now I'm going to be testing your vision with the Snellen chart. So if you could just cover your right eye and read the last line for me.
LTF-PH.
Okay, good. Doing the same on the other side. Cover that other eye, yeah.
LTF-PH.
Good, okay, so vision is intact. Cranial nerve 2 is intact. No vision loss. Now I'm going to checking your extraocular movements. If you could just follow my finger with your eyes, please, okay? extraocular movements are normal. Cranial nerve 3, 4, and 6 are intact. Now I'm going to be checking for your light reflex. So I'm going to have you, I'm going to look into your left eye and notice that your left eye pupil constricts. Good, okay. And now that's the dark light reflex, and now I'm going to look for consensual. So I'm going to look into your right eye and making sure that your left pupil constricts. Good, okay. So consensual light reflex is present, and doing the same on both sides. Now I'm going to be doing your fundoscopic exam. So we're taking a look into your eye. Okay, good. All right, red light reflex is present. Taking a closer look. Okay. Optic disc is sharp. With cup to disc ratio is normal 1 to 2. Macular is seen. Retinal vessels are normal with no signs of hemorrhaging or AV nicking. And then next is after your eyes, we're going to be moving on to your nose. I'm just inspecting your nose. It's positioned normally on your face. I'm going to be palpating for any tenderness. It felt okay? Okay. And we're palpating your maxillary and frontal sinuses. Any type of tenderness? No? Okay, good. Now I'm going to be looking inside of your nose. Okay, so if you can tilt your head back for me, looking inside your nose. Okay, so nasal mucosa is pink and moist. No polyps, excess drainage, or septal deviation noted. And again, I would be doing the same with the other side. Now I'm going to test for the patency of your nose. So if you could just cover one nostril for me and breathe out, breathe in, yeah. Okay, good. Same thing with the other side. Okay, good. Now I'm going to have you close your eyes. I'm going to give you something to smell, and you're going to tell me what you smell, okay?
Cinnamon.
Good. Other nostril.
Perfume.
Good. Okay. So cranial nerve 1 is intact. Sense of smell. Now I'm moving on. I'm going to be looking at your ears. So your ears are symmetrical. There's no deformities noted on your ears. I'm just going to palpate your auricles. Any tenderness? No. Good. Okay. Now I'm going to be taking a look inside of your ear. So inside of your ear, holding your peanut up and back. Okay. Tympanic membrane is seen. There's no excess cerumen. The cone of light is seen at 7 o'clock. Malice is visualized. And the pars flaccida is also visualized. And there's no abnormalities inside of your ear. And I'm going to be palpating your tragus and your mastoid process. Any tenderness over there? No? Okay, good. The tenderness. Next, I'm going to be looking, doing some testing for your hearing test, okay? So taking the tuning fork, I'm going to strike it and put it in the center of your head, and you're going to tell me if you hear it equal on both sides.
I hear it equal on both sides.
Okay, good. Alright, so no lateralization noted, which is normal. Next, I'm going to be striking it again, putting it behind your mastoid process. Tell me when you stop hearing.
It stopped.
Okay. And tell me when you stop hearing.
It stopped.
Okay. Air conduction is greater than bone conduction, which is normal findings, and I will be doing the same thing on the other side. Next, I'm going to come behind you, and I'm going to do a whisper test. So you're going to cover your left ear, and you're going to repeat back to me what I'm whispering.
1, 2, 3,
Okay, other side.
4, 5, 6.
Okay, good. So hearing is normal. Cranial nerve number 8 is intact. Next, I will be looking at your mouth. So just taking a look at your lips are pink and moist, symmetrical. Let me see your teeth. Okay, teeth are aligned. There's no abnormalities with teeth. No missing teeth. Gums are pink and moist. No signs of bleeding. Now I'm going to be looking inside of your mouth. You know what, I forgot. Okay, I'm gonna test with the pen light. Back to your eyes for a second. I'm gonna test for convergence and accommodation. So I'm gonna have you follow my finger for me, and with your eyes, okay? So follow. Okay, eyes converge symmetrically. No nystagmus noted. Now I'm testing for accommodation. So I'm gonna have you just look at the tissue at the glove box for me, okay? And then look at my finger, okay? Pupils constrict when looking from a far object to a near object, which is again normal findings. Next, now we're going to be going back to the mouth. Let me take a look inside your mouth. Say ah for me. Okay, good. Tonsils are seen 2+ equal bilaterally on both sides. Buccal mucosa is pink and moist. Hard palate is firm, soft palate is soft and pink. Frenulum is normal and midline. Uvula is, say it for me. Uvula is midline. Now I'm going to have you stick out your, okay, so now I'm going to, with the tongue depressor, I'm going to elicit a gag reflex. Stick out your tongue. Good, okay, good. Gag reflex is present. Now stick out your tongue for me. And move side to side. Okay, so cranial nerves 9, 10, and 12 are intact. Okay, so moving on from your mouth, I'm going to be palpating your lymph nodes for any tenderness. You're going to tell me if you feel any tenderness, okay? Preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical chain, posterior cervical chain, deep cervical chain, supraclavicular. Any tenderness noted? No. Okay, good. That's normal. Now I'm going to give you some water. Just take a sip of. If you can come turn this way. I'm going to be palpating your neck and checking your thyroid. So just swallow for me. Okay, good. No goiter noted, no tenderness, and no enlargements noted. Observing your neck. There's no abnormalities noted on your neck. The palpate, trachea is midline. Okay, good. And you said no tenderness, right? Okay. Now moving on, I'm going to be looking at your chest. So I'm going to be feeling your chest. Take a deep breath in for me. Good. Okay. Chest expansion is normal. AP to lateral diameter is normal 1 to 2. I'm just going to be palpating your chest. Tell me if you feel any tenderness. No? Okay, good. Okay, next I'm going to be listening to your breath sounds. Okay. Okay, deep breath in. Okay, good. No repetitious breath sounds. Breath sounds are clear and equal bilaterally. Next, I'm going to have you turn. Look at your back. Okay. Okay, so inspecting your back looks normal. No tenderness. No? Take a deep breath for me. Good. Chest expansion is normal. Now I'm going to be taking a listen to your breath sounds in the back. Take a deep breath, whatever you feel like the stethoscope. Okay, good. Now I'm going to be doing test for egophony. So every time you feel my stethoscope, you're going to say E, okay? E, 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 E. Okay, good. E hurts. E, not heard, which is normal. Now I'm going to do the whisper pectoral organ. I'm going to ask you to whisper 1, 2, 3 every time you feel my stethoscope. Okay, sounds were heard as soft and muffled, which is a normal finding. Now I'm going to do the test for tactile ephemeris. So every time you feel my hands on your back, you're gonna say 99.
99, 99, 99, 99.
Vibrations flow throughout. These are normal findings. Next, I'm going to do a diaphragmatic excursion. So I'm going to have you take a deep breath in and hold it. Okay. Okay, dullness noted. Now, let out the breath. Breathe normal, and now take a deep breath in, and then out, and then hold the breath out. Okay, dullness noted. There's a 4 centimeter difference, which is a normal finding. Next, I'm going to be doing the test for pyelonephritis. I'm going to do the CVAT test. So I'm going to be punching your palpating your back, and you're going to tell me if you feel any pain. Okay?
No pain.
No pain. Okay, good. All right, so that's normal. Moving on, I'm going to be taking your vital signs. Okay, bring something around for me. Okay. So observing your respirations for 15 seconds. Okay, so respirations are 16 and R16, which is normal. Now I'm going to be doing your blood pressure. I'm going to look up your blood pressure is 112/70, which is good and normal. Okay, next I'm going to be feeling for your radial pulse for 15 seconds. Okay, your radial pulse in 15 seconds is 20, so in a minute that will be 80 beats per minute. Okay, so next I'm going to inspect your chest. Moving on to the cardiac exam, I'm going to inspect your chest and locate the anatomical spots of your heart. So we have the aortic valve, which is the right second intercostal space. Pulmonic, which is the second left intercostal space. Tricuspid, which is the fourth midclavicular line on the left side. and your apical pulse, which is your mitral valve, which is your fifth intercostal space mid-clavicular line. Now I'm just going to palpate your apical pulse. Okay. Your prime maximal impulse. Okay. Good. All right. Now I'm going to take a listen to those same spots. So this is, and I'm going to be listening with my diaphragm and my bell, but for purposes of the exam, I'm going to do it twice. Aortic, pulmonic, tricuspid, and mitral. Okay, good. Now I'm going to have you sit back for me. I'm going to lay it back a little bit more. Okay, good. Alright, so about 30 degrees. Again, I'm going to be inspecting. I'm going to be palpating your chest as well. So aortic, pulmonic, mitral, tricuspid, I'm sorry, and mitral. Okay. Next, I'm going to be listening again. Again, both times with my diaphragm and the bell. Aortic, pulmonic, mitral, tricuspid, and mitral. I'm sorry, I'm going to have you sit up one more time. When I listen to the mitral, I'm going to have you lean forward, okay? Okay, good. You can lay back. Now I'm going to be looking at palpating your carotid artery. So I'm going to have you look that way for me. One at a time. Good. Other side. Good. Okay, so carotid arteries are carotid pulses are 2 plus equal bilaterally. No signs of heaves or thrills. Also, when I palpate your chest, there's no signs of heaves or thrills. The S1 on auscultation of your heart, S1 and S2 are heard. No cardiac murmurs or gallops present. Now I'm going to have you turn your turn your head to the look to the left. Okay, so no JVD noted. Now I want you listening to your carotid pulses with the bell. Good. Other side. Good. Okay. Now I'm going to be palpating your pulses. Okay, other pulses. This is brachial, radial. Okay, femoral, dorsalis pedis, and posterior tibial. Okay, using the bell of my stethoscope, I'm going to be listening as well to each pulse, and I will be doing the same on both sides. Radial, brachial, femoral, dorsalis pedis, and posterior tibial. Okay, no bruise heard. And now I'm going to be checking for your pulse deficit. So I'm going to be listening to your apical pulse while palpating your radial pulse. Okay. So both pulses are 80 beats per minute, which is consistent with your heart rate, and no pulse deficit noted. So moving on from the cardiac exam, I'm going to be looking at your abdomen. So your abdomen appears to be symmetric. There's no aortic pulsations, there's no signs of hernia, There's no deformities noted on the stomach. Now I'm going to be just taking a listen. Okay. To your bowel sounds. Okay. So bowel sounds are normal active. There's no abnormalities heard when I was auscultating your bowel sounds. I'm going to now I'm going to percuss. Okay, tympany heard throughout, which is normal. Now I'm going to be palpating. I'm doing light palpation. Tell me if there's any pain or tenderness. No. Okay, now I'm going to do deep palpation. Any pain or tenderness? Okay. Now I'm going to be laying back a little more. Sorry. Okay, good. Now I'm going to be, since I'm on this side, I'll be percussing your spleen. Okay, so tympany heard throughout, which is normal. Now I'm going to be palpating your spleen. Okay. So the spleen is non-palpable, which is normal. Moving on to the other side, I'm going to looking at your liver. So I'm going to have you, I'm first going to be percussing your liver. Abdominus noted. Abdominus noted. The difference is 6 millimeters, which would be normal size for your spleen, for your liver. Now I'm going to be palpating your liver, so I'm going to have you take a deep breath in for me. Okay. So the liver is felt on palpation. No hepatomegaly felt. Now I'm just going to be palpating your inguinal nodes. Any tenderness there? No. Good. Okay. Sitting you up. Okay. Next, I'm going to be testing your musculoskeletal. Okay? So get that up for me. And if you could come over here, I'm going to go get your spine. Good. Okay. Just observing your spine, looking at your back. Your back looks normal. There's no signs of scoliosis or kyphosis or any abnormalities seen with the alignment of your spine. I'm going to be palpating your spine and your perispinal muscles. Any tenderness? No. Okay. So your spine feels normal. Now I'm going to be checking for movement of your spine. So if you could just look down for me. Okay, good. Look up for me. Okay. Bend back for me as much as you can without leaning too far back. Yeah. Now if you could lean all the way forward, touch your toes. Good. Okay. And now I'm going to have you turn from side to side. From side to side. Move your spine. Good. Okay. Okay, good. So movement of your spine is normal. Now I'm going to have you turn around. And I'm going to look at your, so look at your face. I'm going to do looking at T&J. I'm going to have you clench for me. Good. Okay. Good. And then if you could stick out your jaw. This. Move your jaw back, side to side. Okay. Any pain with doing that? Okay. So no pain or clicking or abnormalities felt with movement of the jaw. Now I'm going to be checking movement of your neck. So I'm going to have you look down for me, look back up for me, side to side, ear to shoulder. Good. Okay, cheek to shoulder. Good. Okay, and then just do a 360 for me. Good. So movement of the neck is normal. Now I'm going to be inspecting your shoulders. Inspection of your shoulders seem symmetrical and normal. There's no deformities or abnormalities. I'm just going to be palpating any tenderness. No tenderness, no crepitus. No abnormalities of the shoulders. I'm going to have you lift your shoulders up for me. That, good. Again. Okay, good. Now nerve 11 is intact. Movement of the shoulders. Now I'm going to have you put your arms up like this. Yeah, and back. Good. And this is testing for range of motion of your shoulders. Now I'm going to have you put them back up and touch each shoulder blade. Yeah, good. One by one, good. And just do 360. Movement of your shoulders, good, okay. So movement of the shoulders is normal. Now I'm going to test your movement of, so first I'm going to be inspecting and palpating your elbows, no tenderness, no crepitus, no swelling or abnormalities of the elbows. Now I'm going to have you put your arms out for me, okay? Open, turn around, good. And back, and then flexion, okay, good. And extension, good. Okay, so movement of the elbows is normal. Now moving on to your wrist. I'm going to have you, your wrists seem normal. On palpation, there's no tenderness, no abnormalities on tenderness. On palpation, no crepitus, no swelling. Now I'm going to have you lift them back for me, down for me, good. Just do a circle, 360, good. Out for me, and in for me, good. Okay, so movement of the wrist is good. Now I'm going to be looking at your fingers, movement of your joints of your fingers. So your MCP, PIP, and DIP are normal on palpation. Can you, yeah, like make a fist, open up, good. Abduction, good. And then if you could just touch each finger with each finger to your thumb. Good, okay. Good. The movement of the fingers are normal. Now I'm going to be moving on to your hip. So just inspecting your hip. It seems normal and symmetrical. No abnormalities seen on inspection. I'm going to be palpating. Any tenderness when I palpate? No? Okay. So I'm going to have you come sit back down. Good. Okay. I'm going to lay you back down, okay? Laying you down. Good. Okay, so now I'm testing the range of motion of your hip. So I'm going to have you lift up your leg for me. Okay, and bring it in to your chest as much as you can. Good. Now flex it all the way out. Good. Okay. Now bringing it back to this position, you're going to do internal rotation. So bring it towards the other leg. And external rotation. Good. Okay. Next, I'm going to have you can bring it back. Do the same thing with the other side. So bring it up towards you. Extension. Good. Internal rotation. So external rotation and then internal rotation. Good. Okay. So movement of the hip is normal. Next, I'm going to be doing. You can come back and sit up. Sorry. Okay. Next, I'm going to be looking at your knees. So again, no tenderness, no crepitus, no abnormalities noted on inspection or palpation of your knees. Now I'm going to have you lift your feet out and back, like as back as you can. Yeah, good. Okay, so these are good. Next, I'm going to be looking at your ankles. So your ankles, so on inspection and palpation of your ankles are normal and no abnormalities or deformities felt. No tenderness, swelling, or edema. I'm going to have you, up and down, good, side to side, and just make circles with your ankles, good. So the movement of the ankles are normal. Next, I'm going to be doing your toes, so it's the MTP, PIP, and DIP. Of your toes are normal. No tenderness or swelling felt on your toes. And if you could just bring your toes up like this for me, good, and back down, good, okay. All right, so movement of your toes is normal. Now I'm going to be doing some tests of your gait. So if you can walk for me, I'm going to have you walk that way, 10 feet, good. You come back to me, okay. So gait is normal with regular movement. Now I'm going to have you do toe to toe. So take a step like this for me. Like that. Good. So balance is normal. Now I'm going to have you just walk on your tippy toes front and then turn around and walk on your heels. Okay, so balance and gait are normal so far. Now I'm going to have you could stand like closer to the wall, and you could just close your eyes, and I'm going to be observing if you're for swaying with your eyes closed. Okay, so no swaying noted. Balance is normal. Now I'm going to have you lift your arms up for me, and then keep your eyes closed. I'm just noticing if there's any drift. No unilateral upper extremity drift. This is normal. Keep it down. Good. Okay. And then next, I'm going to have you come back and sit down. And I'm going to have you put your foot to shin and rub it down. Good. On both sides. Perfect. Next, I'm going to have you close your eyes. I'm going to put some stuff in your hand, and you're going to tell me what it is, okay? Close your eyes. Close your eyes. Good. And then tell me what you're holding in each hand.
A coin in this hand and a pen in this hand.
Perfect. That's good. Okay, so next I'm going to be have you close your eyes, and you tell me what you feel on your tell me what you feel, okay?
It's soft on my forehead, on my face.
Yeah.
Soft on my face. Soft.
Okay, good. So cranial nerve 5 is intact. And next I'm going to have you puff out your cheeks for me. Good. Smile, frown. Okay. Raise your eyebrows. Okay, good. So cranial nerve 7 is intact. Okay. Next I'm going to be doing I'm going to do some more sensory tests. So I'm going to test for I'm going to test for sharpness. And you're going to tell me where you, this is what sharp feels like, and you're going to tell me where you feel it, okay?
Okay. In my left shoulder.
Good.
In my right shoulder. In my right arm.
Okay.
In my right leg.
Mm-hmm.
In my left leg.
Okay. Alright, now I'm going to test for dull and pain. So you're gonna tell me, okay, so this is dull and this is pain. You're gonna tell me what you feel, okay?
Dull. Pain. Dull. Pain.
Okay.
Dull.
Okay.
Pain.
Good. Next I'm gonna test for your strength. So I'm gonna have you I'm gonna put my hand on your cheek, and you're gonna try to turn your face towards my hand. Good. Test your strength. Good. 5 out of 5. Other side. Good. 5 out of 5. Now I'm gonna test if you open up your mouth for me. Good. Close. Okay. So again, cranial nerve 5 is intact. Now I'm going to be testing your shoulders up. Good. Okay. Your arms. So push up. Good. And push down. Good. I'm gonna do with your legs. So push up. Good. And then I'm gonna lay back a little bit, and then try to push down. Push down again. Good. Okay. Then push up. Good. And down. And then with your feet, push down. Good. And push up. Good. So strength is 5 out of 5 on all areas of the body. Next, I'm going to be doing your, okay, I'm gonna test for vibration, okay? So you're gonna tell me if you feel vibration and where you feel it.
In my left shoulder. In my left elbow.
Okay,
In my left knee. My right knee.
good,
In my right foot.
good. You feel the vibration? Okay. Good. Next, I'm going to be checking your reflexes. Where is it? Here. Thank you. So when we're checking your reflexes, I'm checking your brachioradialis reflex, okay? Okay, good. And your bicep. Okay, and tricep. Good. Now we're testing your patellar. Good, okay. And your Achilles. Good. And we'll be testing for Babinski's, so you should be seeing your toes curl down. Good. So all reflexes are normal, and that completes our exam today.